With globalisation, health has become an international issue. World leaders descending on London for the G20 summit know that healthcare is a major issue that needs to be tackled. Britain's Foreign Office Minister, Lord Mark Malloch-Brown, spoke at Chatham House about how globalisation had brought a third age of health.
Now we live in an era where our sheer integration as a global society has brought its new health threats, and at the same time the imbalances in health provision between rich and poor countries serves as a source of considerable insecurity, but also in its own way contributes to security threats for all of us.
He also outlined how globalisation tested our resistance to new diseases.
Of course, it's contagious diseases that have tremendous success in evading different existing drug regimes. So whether it is the outbreak of SARS some years ago, the more recent risks and threats of avian flu, or new HIV strains, there is a sense that diseases are continuously testing our healthcare developments and our drug regimes to find ways round them.
With growing levels of foreign travel and migration, health now has an international dimension.
Our global health has become more interdependent in that one man's health is quite literally another man's security threat because of these migration-induced pressures that health contributes to. But equally, one man's illness carried by plane or by even an illegal boat trip, by migrants, poses a huge threat to tens of thousands of men and women at the other end of that journey because of the nature of modern communicable diseases.
He says to combat this, the UK has developed its own global health strategy.
It's in that context that we felt it enormously important to develop a global health strategy that, dealt with issues of access to healthcare, sought to work out how we could provide and support improved healthcare for people in poor countries, but dealt also with, if you like, the ethical and moral issues, so that our response was not a Fortress Britain response, where fear of other people's health problems became one more reason to tighten immigration controls, or one more reason to close down the ease of international travel.
He also felt that the issue of health needed to be a high priority at the G20 London summit.
Here in London, as we prepare for the global G20 summit here, we'll try and make sure that these health issues remain very much front and centre. The G8 summits have been important forums in Japan last year, in Germany before that, to raise money for these big global health issues, the Global Fund, Gavi, etc. But we've got to start drawing this together into a more coherent architecture.
He concluded that with globalisation, there needs to be a long-term focus on public health intervention and the development of a realistic, affordable healthcare service available to all.